This is exercise 13, now focused on the leg muscle. We're going to start at the top and move down. So there's 4 muscle groups that are known as Quadriceps Femoris. This includes the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. The vastus intermedius is deep to the rectus femoris, so you cannot see it unless you remove that muscle. They're involved with extending the knee and flexing the hip. As you can tell, the names, once again, of the muscles often help to tell you the location, the placement of it. The rectus femoris, it's near the femoral area, which you know is the thigh. The vastus lateralis and vastus medialis and vastus intermedius gives you the location. Is it more medial? Is it lateral in its location? This is showing that vastus intermedius with the rectus femoris removed, so you can actually see it. The Sartorius is often used as a landmark muscle to help place, once again, you can pinpoint that because it's kind of unique. It's often referred to as the Taylor's muscle. It's the longest muscle in the body. It kind of crosses over from the knee up to the hip. And so you can usually easily pinpoint that one and then use that as your landmark. As I've said before, oftentimes with learning your muscles, how many muscles to the right, to the left, etc. But that can be your landmark. It's involved with flexion, abduction, lateral rotation of the hip, flexion of the knee. It allows you to sit cross-legged. The adductus helps to flex the hip. The adductor longus, as the name implies, helps with adduction of the hip. Adductor magnus, also adduction of the hip and flexion. Pectineus, gracilis is helping with flexion and medial rotation of the knee. The tensor fasciae latae has several different movements that it's helping to assist with, such as flexion, abduction, medial rotation of the hip. It helps to strengthen and steady the trunk when you go to stand up. You do have the insertion of the iliotibial tract that's going to extend across the lateral side of the knee, helping to stabilize it. The Gluteus Maximus helps with extension and rotation of the hip. It helps to stabilize the pelvis and the thigh when you're standing. It is a very powerful muscle. The gluteus medius is below it, so you have to remove that muscle on a model in order to see it. It is also going to help steady the pelvis when you're walking, and it is involved with abduction and medial rotation of the hip. The hamstrings, this includes the muscles of biceps femoris, semitendinosus, and semimembranosus, involved with extending the hip, flexing the knee, medial rotation. This is one example of the biceps femoris where I always tell my students, you have to use the full name of the muscles when you're labeling things. A lot of you may be very familiar with the biceps brachia in the arm and referring it as just the biceps. In anatomy class, do not do that, because if you just say biceps, do I know whether you're talking about the biceps brachia or the biceps femoris? So you need to use the full name so I know what you're talking about. I know that you're in the right location because one's in the leg and one's in the arm. Triceps area, these 2 muscle groups. You've got the gastrocnemius, very large muscle on the back of the lower leg, the calf. The soleus is partially deep to that, which you can see right here. It's the head of that muscle is under the gastrocnemius. So the gastrocnemius is for plantar flexion and knee flexion. The soleus is for plantar flexion. Fibularis longus is for inversion of the foot. Fibularis brevis also. Remember, the long muscles do attach to the fibula. The extensor digitorum longus helps to extend the toes. Flexor digitorum longus, once again, helps to flex the toes and plantar flexion of the foot. Flexor hallucis longus also is involved with plantar flexion and also flexion of the great toe, which is known as the hallux. Extensor hallucis longus, extension of that great toe now and dorsiflexion. Tibialis posterior. Now, the name of this should tell you it's on the back. It's involved with plantar flexion and inversion. And the tibialis anterior is going to be on the front because it's anterior.